Welcome to Educates on rabies. Rabies is a viral disease transmitted from mammals to humans that causes an acute encephalitis or inflammation of the brain. Bites from infected animals are the most common mode of transmission to humans. Exposure to rabies may come from bites of infected dogs, cats, and other domestic and wild animals, including bats. After entering the human body, the rabies virus travels along the peripheral nerves until it reaches the central nervous system through the spinal cord and brain. The incubation period for rabies is typically 2 to 3 months, but may vary from 1 week to 1 year, depending on the location of the bite and viral load. Initial symptoms may include fever and weakness. Patient may also feel pain, with tingling, pricking, or burning sensation at the wound site. As the virus spreads to the central nervous system, more severe symptoms may develop. There are 2 forms of the disease, the furious rabies and the paralytic rabies. Furious rabies, which accounts to 80% of human cases, causes signs of hyperactivity, aggression, hallucination, excessive salivation, hydrophobia, or fear of water, and sometimes aerophobia, or fear of fresh air. Death occurs after a few days due to cardiorespiratory attack. Paralytic rabies, which accounts to 20% of human cases, runs a less dramatic and usually longer course than the furious form. Muscles gradually become paralyzed, starting at the site of the bite or scratch. A coma slowly develops and eventually, death occurs. Here are 5 myths and facts about rabies. Myth: washing alone is enough to treat rabies. Fact: first aid is an absolute must. Wash the bite area with soap and water for 15 minutes, then clean the bite wound with povidone iodine. The person should then be brought to the nearest animal bite center or health facility. Myth: when you are bitten, there's no need to seek consult because rabies has no cure. Fact: rabies is life-threatening when left untreated. This is why it's important to seek immediate treatment of post-exposure prophylaxis. It consists of a dose of human rabies immune globulin and rabies vaccine given on the day of the rabies exposure, and then a dose of vaccine given again on days 3, 7, and 14. Myth: rabies is only transmitted by stray dogs. Fact: in general, rabies can be transmitted by unvaccinated animals, including domesticated dogs and cats. Make sure to vaccinate your pets against rabies every year. Myth: rabies is only transmitted through animal bites. Fact: rabies can also be transmitted through non-bite exposures such as licks on broken skin or mucous membranes, inhalation of aerosolized virus, and organ transplant. Myth: if a dog bites a person, it is only important to care for the person. Fact: if a dog bites a person, it is necessary to catch the dog and isolate it in a room or cage for 10 days to observe it for abnormal behavior, in addition to making sure the person who was bitten receives proper treatment. Remember, be a responsible owner and vaccinate your pets to protect them, yourself, and your family against rabies. In the event of an animal bite, do first aid and seek immediate medical care.